The Kingdom of Eswatini, which once had a high prevalence of HIV in the world, is on track to reach 0 infections by 2030. In 2020, the country became the first on the African continent to achieve 95 targets ahead of 2025. So what does that mean? Well, we speak to the Acting Executive Director of National Emergency in the country, Dumisani Kunene. Kunene, thank you very much for your time this afternoon. Maybe let's start with that. What does 95 mean?
The first 95 means that those people that are estimated to be positive, they're fully tested and they're aware of their status. And those people that have tested, 95% of them are on treatment, and those people that are on treatment are virally suppressed. 95% of them are virally suppressed. So that's what 95 means.
When we say that the Kingdom of Eswatini is on track to stave off HIV infections, maybe you can paint a picture for us in terms of what the situation was like and what you are looking like now. We'll get into the interventions, but maybe just draw parallels between the two situations for us firstly.
Yeah, 20 years ago, basically, I think in the mid-80s, we had a situation in Eswatini where we just saw the new infections spiraling beyond control, and there were no services, and basically all systems were not ready to handle HIV. So we had high infections that were perpetual every year. We jumped from low levels like 3% to about 32% within a very short space of time in terms of the prevalence of HIV in Eswatini. And then, as if that was not enough, we had a lot of people dying, and the consequences of that is that we had a lot of orphans. So Swaziland at that time basically was known for the high HIV rates and also the high HIV deaths. And therefore, it was a scary place to be for those that were outside.
What has assisted the country in almost reaching the 0 infection targets?
I think what has assisted the country basically is to ensure that the efforts of the implementers that were implementing activities then were coordinated, and also the injection of more funding towards HIV/AIDS by government, and also mobilization of funds from external donors. That has basically galvanized the AIDS response in Eswatini, and the resilience and the strength of our foot soldiers, including the Ministry of Health in particular, because what was happening is that we were having high infections, but treatment was lacking behind. And for you to start treating, there were many systems that you needed to put in place. It was not just the drugs only. You needed to ensure that we've got a vibrant laboratory, and also you had also infection management, infection control between HIV patients and basically those that were TB infected, because most of the deaths were caused by TB infections. So it was basically that, I would say, resilience and speed of implementation that all of us in Eswatini basically had to attain to. And the political call, by His Majesty, when he told everyone that HIV was a concern for everyone. HIV in Zabaitu Songo, you must have heard about that slogan in Eswatini. And from that time, everyone worked hard and worked together towards addressing the gaps in HIV, to an extent that today we are talking about a situation where, in terms of services, we've got our services now have basically they've exceeded demand, whereas in the earlier years, people demanded services that were not there. So now we've basically reached actually even past the equilibrium point between service delivery and demand for services.
You speak of the King's message. Eswatini is the population rather is quite intimate. I think at 2021 it was less than 2 million people. And so what is it that the King enforced or reinforced among the population that they took to it so well, more so when we speak about prevention, the kind of behavior that would even not lead to transmission or infection?
I think The critical thing about having someone that you can all listen to is that, in the culture of Eswatini, is that once the king say, let us take this direction, there's that agency from everyone to take that direction. So that's what basically, created a big momentum here, is that when the king had then instructed and decreed what should be done, then all of us basically were looking at how can we participate, how can we make HIV our concern, how can we make AIDS our concern, how can we reach out and basically intervene, at community level. Because remember, HIV is basically the people living with HIV stay in communities where there is stigma, and the orphans that are there are basically staying in communities where even those communities were struggling, because HIV just eroded resources at every level, but the communities were able to stand up after that call by His Majesty to ensure that, they were taking care of not necessarily taking care in the extent that the orphans would have liked, but at least they were not neglected. There were some basic services that were being provided and basically basic interventions that were provided to the orphans. And people were basically encouraged to go to hospitals. So it was more sort of a momentum, a social movement towards those that were sick to be taken to hospital, and our hospitals were quite ready also to basically ensure that they tested and diagnosed and then enrolled on treatment. Even following the people up, because it was not just, put them on treatment, it was put systems in place to ensure that the people, once they're on treatment, they do not default and they remain alive. So that's why in Swaziland we remain with a high prevalence, because people here are not dying of HIV.
Thank you so much, sir, for your time this afternoon. Dumisani Kunene, Acting Executive Director of National Emergency Response Council on HIV/AIDS, joining us from Mbabane in Eswatini.